I used to work night shifts at a small-town hospital as a nurse. Most nights were uneventful, just routine checks and paperwork. But one night about a year ago still haunts me. It was around 3 a.m. and the ER was quiet. I was charting in the nurse's station when the automatic doors slid open. A man staggered in, clutching his stomach. He was pale, sweating profusely, and his eyes were wide with fear. I rushed over, calling for a doctor. As I helped him onto a gurney, I noticed something strange. His shirt was soaked with blood, but there was no visible wound. The doctor arrived and we wheeled him into an examination room. While the doctor examined him, I stepped out to grab some supplies. When I returned, the man was gone. The doctor was standing there, looking confused. "Where did he go?" I asked. The doctor shook his head. "He just disappeared." We searched the entire ER, but there was no trace of him. Security footage showed him entering the hospital, but there was no footage of him leaving. It was like he vanished into thin air. Over the next few days, I couldn't shake the feeling that something was off. I asked around, but no one had any information about a missing patient. Then a week later, I was on another night shift when an older nurse pulled me aside. "You saw him, didn't you?" she asked. I nodded, and she sighed. Follow for part 2.